dear learners. Here I am with the third module of capsule dosage forms. After learning this module, you will be able to understand about the soft gelatin capsules, their filling, various principle and methods of fillings, formulation principle of soft gelatin capsules. The lesson plan for this module will be like, at first we will discuss about the introduction of soft gelatin capsules, their methods of filling, advancement in the methods of filling, and at last we will discuss about the formulation aspects. Now, the definition of the soft gelatin capsules. Soft gelatin capsules are a single unit solid dosage forms consisting of a liquid or a semi solid as filling material, enveloped by one piece hermetically sealed elastic outer shell, formed, filled and sealed in one continuous operation, preferably by rotary dry process. Now, what are the reasons for the selection of soft gelatin capsules as formulation? There could be several reasons for that. The first one is strategic reasons, like line extension. Line extension can be explained as when we have already a brand name for a particular API and we want to expand that API in another formulation. Soft gelatin capsule is most preferable next formulation for that reason. The next reason could be technological issues like high content uniformity of low dose drugs. So, in case of such drugs or such APIs, when the dose is very low, we choose soft gelatin capsules for the formulation aspect. The third reason is safety aspect. Formulation of a drug in case of soft gelatin capsule reduces the operator and the environmental contamination with highly potent and cytotoxic compounds. The last reason could be the consumer preference. In comparison with the tablets and the hard gelatin capsules, soft gelatin capsules are easy to swallow. So, it could be a good reason for the selection of a formulation as a soft gelatin capsule. Now, what are the advantages? Soft gelatin capsules are easy to swallow, they had no taste, unit dose delivery is possible with the soft gelatin capsules, they are tamper proof, wide variety of colors, shapes and size we can attain, accommodates a wide variety of compounds filled as a semi solid, liquid, gel or paste. In case of soft gelatin capsules, immediate or delayed drug delivery system both can be achieved. Soft gelatin capsules can be formulated as immediate or delayed drug delivery system, and these can be used to improve the bioavailability of delivering drug in solution form or other absorption enhancing media. There are several disadvantages also. First one is soft gelatin capsules requires special manufacturing equipments. The stability concern with high water soluble compounds and the compounds susceptible to the hydrolysis. The limited choices of excipient or carriers compatible with the gelatin is also a disadvantage in case of soft gelatin capsules. Now, how we prepare the soft gelatin capsule? So, the composition of soft gelatin capsule on the basis of formulation and category comprises of a shell material like gelatin, PVA, carrageenan, a plasticizer, it could be one or more than two or two plasticizers in combination, water as a solvent, preservatives, coloring agent, opacifying agent, flavoring and sweeteners. On the basis of the solubility of the material being used to formulate the soft gelatin capsule, we can classify the composition in hydrophilic solvent like water or chloroform or methanol. Chloroform is not generally used in case of soft gelatin capsule, but methanol is used in few formulations. Lipophilic material like vitamins. The third category is hydrophilic surfactants, fourth category is lipophilic surfactant, and the last is co-solvents. Here we can see a representative diagram of soft gelatin capsule. It contains either solution of drug lipophilic film matrix or a suspension of drug lipophilic film matrix, or optimization of these two substances for chemical or physical stability. Now, I would like to summarize what we have covered till now: the definition, the reason behind the formulation of soft gelatin capsules, advantages and disadvantages, and the composition. Now, I would like to discuss the prerequisites of soft gelatin capsule formation. There are 3 points majorly we have to monitor during the formulation of soft gelatin capsule. The number 1 is selection of appropriate shell material. The number 2, selection of appropriate fill composition, and the third one is optimization of these two principles for physical and chemical stability. Now, I would like to discuss about the shell forming agent. The most used is gelatin. There are few qualities of gelatin required in case of soft gelatin capsule, which varies in comparison with the hard gelatin capsule. For example, the gelling strength. The gelling strength in case of soft gelatin capsule should be 150 to 200 brooms of gelatin, which is being used as a shell material. The viscosity of gelatin should be in range of 2.8 to 4.5 millipascal. Generally, we prepare 6 to 23% weight by weight solution of gelatin in water at 60 degree centigrade for the preparation of soft gelatin capsules. A degree of viscosity should be well controlled, well defined particle size to allow fast dissolution and de-aeration of the molten mass even at the high gelatin concentration. In general, we see that air bubbles are get entrapped in the molten mass and which disturbs the formulation. So, the particle size of gelatin should be in the well defined range which allows the de-aeration properly. A broad molecular weight distribution to provide fast setting and the fusion temperature being well below the melting temperature of the plasticized wet film. In this graph, you can see there are 3 types of gelatin taken in this particular study. Type 1 gelatin, it is the gelatin with high foam fraction and high stability. Type 2 gelatin with the high foam function but low stability, and the type 3 the less foam function and less stability. In this graph, every curve shows 2 phases. Phase 1 showing the increase of foam value following the injection of inert gas, and phase 2 the value decreases after the injection of gas. As foaming is undesirable in soft gel formulations, so we would like to choose the type 1 gelatin for the formulation. In this diagram, the effect of moisture present in various concentration in the cell of soft gelatin capsule has been shown. In the left one diagram, the moisture content is higher than 11% and the normal type of soft gelatin capsules we can get is only 15%, and the rest 85% are sticky in nature. While on the right hand we can see that the moisture content is less than 11% and the sticky type of soft gelatin capsules are only 6% and the rest are normal. So, it concludes that the moisture content in case of soft gelatin capsule should be less than 11%. Now, plasticizers. There are few examples of plasticizer like glycerol. Glycerol can be used in the concentration of 85% or 98% weight by weight. Sorbitan solutions, propylene glycols, low molecular weight polyethylene glycols, PEG 200. Now, what should be the property or the composition of the plasticizer for a good type of soft gelatin capsule? The strength of shell is directly depend on the ratio by weight of the dry plasticizer with the dry gelatin. For example, in case of hard gelatin capsule, the drug versus plasticizer ratio is approximately about 1 to 0.4. In case of soft gelatin capsule, we use high plasticizer concentration, such as drug versus plasticizer ratio should be approximately about 1 to 0.8. Plasticizer affects the formulation in either direct way or indirect way. The directly interacting plasticizer affects the formulation or the soft gelatin capsule shell by high degree of reduction in the glass transition temperature of gelatin during the preparation. It means the plasticizer, when it is added with the gelatin solution, it reduces the glass transition temperature of gelatin. Second, it also maintains the crystal formation within the sol gel network of gelatin. These are most effective and stable. The direct interacting plasticizers are most effective and the stable ones. Again, slight increase in the hygroscopicity can be seen after using the direct interacting plasticizer. Glycerol is a good example. Now, indirectly interacting plasticizer, how they work? A very minute reduction in the glass transition temperature of gelatin during the preparation is the prime effect of indirectly interacting plasticizer. It also produces moisturizing effect, which is actually the cause of formation of soft gelatin capsule. It does not maintain the crystal formation within the sol gel network. It is less effective and unstable in comparison with the directly interacting plasticizers. These are mostly used in the combination. For example, sorbitol and sorbitan combinations. Now, I would like to conclude that we have covered the formulations and the composition, like the type of composition on the basis of formulation and the type of composition on the basis of solubility. First, we have discussed about gelatin and then we discussed about the plasticizers. Now, I would like to discuss the factors to be considered for filling materials. The filling material, when we used in the formulation, the temperature of the fill material should be approximately about 37 to 40 degrees centigrade. Viscosity is also an important parameter when we are filling the formulation. So, the viscosity of the filling agent should be approximately similar to the shell forming agent. The surface activity should be less and the particle size of the suspended drug, in case of especially suspension, should be less than 200 micrometer. A higher range of particle size will affect the dissolution and the deaeration of soft gelatin capsules as we discussed earlier in this particular module. Few other formulation considerations are like possible interaction. There are two types of possible interactions. The first one is chemical reaction of fill component with the gelatin or and the plasticizer, and the second type of interactions are physical interactions. For example, migration of the fill component in or through the shell and vice versa. So, how can we control any one of these? To control the physical interaction like migration of the fill component, we generally control the water content of the fill should not be exceeding a critical value of about 5%. Using the water content lesser than 5% in the fill material, we can inhibit the physical interaction, especially the migration of fill components. Few other formulation considerations are for minimizing the hydrolysis and the oxidation of the formulation like chemical interactions. If we want to minimize the chemical interactions, we can use the gelatin of high bloom strength and low viscosity. What it will does? It does the faster drying. Now, as earlier we discussed how to reduce the physical interaction. Now, what can we do about the chemical interaction? So, for minimizing the hydrolysis or the oxidation of the formulation, we use the gelatin with high bloom strength and low viscosity. Now, what is the effect? It affects in the drying. When we use the gelatin with high bloom strength and the low viscosity, the drying rate increases. Alternatively, we can do the replacement of single plasticizer by the blend of two or more, and it will result in the minimizing the diffusion of API into the shell. We can also coat the drug particle to inhibit the browning reaction. So, using these type of steps, we can reduce the chemical interaction between shell, filling material or plasticizer. For the formulation consideration, it is very important to discuss the post treatment or the coating of soft gelatin capsules, because it also helps to enhance the stability of the formulation. It includes aldehyde treatment. In general, we do not use any post treatment or coating, but in specific cases like vitamins, we use aldehyde treatment to stabilize the formulation. It is very difficult though. Low surface roughness and intrinsic solubility of the shell components in organic solvents results in non-adherence of the coating material. So, it is very difficult to do, but we try in specific cases to post treatment or to coat the soft gelatin capsules. In discussion with the gelatin preparation, the process of blending and heating granulated gelatin and other ingredient in warm water in a gelatin melting tank is very crucial step. Color may be added during the melting process or in a separate machine. Filling material preparation, how can we do that? What are the steps for the soft gelatin capsule cell formulation? The first step is gelatin preparation. In this process, we blend and heat the granulated gelatin and other ingredients in warm water in a gelatin melting tank. During this process, we can add color in that particular tank or in a separate machine. The next step is fill material preparation. The preparation equipment may include processing tank, mixer, vacuum homogenizer and sieves and mills. So, we prepare gelatin solution and fill material separately. Afterwards, we combine them by the next process, which is called encapsulation, converting the gel mass into a thin layer of gelatin and wrapping it around the fill material to form a soft gel. After preparing the soft gel, we go for drying. We remove the excess moisture from the gelatin shell to shrink and firm up the soft gel either by tumbling or by the combination of tumbling and tray drying. The last step is cleaning, inspection and sorting of the soft gelatin capsules. It often requires a prior to packaging based upon the intended use of the soft gel. In this diagram, you can see various parts of the soft gelatin capsule filling machine. The equipment for soft gelatin capsule cell is single type and it is not very complex. So, I would like to discuss the equipment with its advancements or recent advancements. We have a product pump at the upper part of the equipment. It could be a separate type or attached type. The injection time adjustment from this particular product pump could be a electronic system or a manual system. The next important part of that equipment is injection wedge. It could be a manual wedge or a pneumatic wedge. Pneumatic means pressure based. The rollers could be electronic or pneumatic pressure based. The roller should be attached with the internal heating system. After the rollers, there is a ribbon system in the soft gelatin capsule filling equipment. The ribbon system could be of electronic or a pneumatic type. In that ribbon system, there is a oil quantity adjustment function is there, which could be of electronic type or a manual type. Then the collection assembly is following after the ribbon system. The collection assembly could be of a chute or a divider. The speed of that collection assembly, you can use it as a fixed or a variable speed as per your convenience. The conveyor is the lowermost part of the soft gelatin capsule filling equipment. The conveyor could be a unidirectional or a bidirectional one. So, how we will ensure the product we are getting after a particular process is the best process? Can we check the product within the process? Yes, we can. There are few in process tests which assures the quality of the product. In such tests, gel ribbon thickness test is the prime. The second is soft gel seal thickness at the time of encapsulation. The film matrix weight and the capsule cell weight variation we can check within the process. Soft gel cell moisture level and the soft gel hardness at the end of the drying stage can also be a representative of the in process quality. The finished product tests include capsule appearance, active ingredient assay and related substances assay, fill weight variation or content uniformity or both can also be considered as the finished product tests. Microbial testing are also necessary in case of soft gelatin capsule as they carries the gelatin as the shell forming agent, and in case of gelatin it is very much possible that it grows microbes on the surface or inside the capsule cell. Now, what are the limitations of the soft gelatin capsules? In case of liquids that can easily migrate through the gelatin shells such as water, if we use water more than 5% of the fill, the hygroscopic and the volatile compounds. We cannot use these liquids for the soft gelatin capsules. Aldehydes we cannot use. Why? Aldehydes have the ability to harden this shell and hence affects its dissolution property, the dissolution property of the cell as well as the formulation. We should also avoid the acidic and the alkaline solutions, because they are adjusted to become neutral and they lose their activity. If we use acids and alkalis as they are, they cause hydrolysis and the leakage of gelatin shells. Water soluble solid compounds that may affect the gelatin shell unless they are minor constituents of the formula or combined with the carrier that reduces their effect on the cell are also a limitation for the soft gelatin capsules. So, at last in this lecture we learnt about soft gelatin capsules as dosage forms and their importance. We also discussed about the method of filling and their advancement. We also discussed about the formulation consideration of the soft gelatin capsules, and at last we discussed the limitations related to the soft gelatin capsule formation. Please go through the suggested further readings. Do take part in the discussion forum if you have any query regarding the content of this module. Thank you so much for paying attention.